25 years ago, I thought I had figured it out all by myself as an young doctor until the life knocked the wind out of me. Not by a storm, but a cold wave, literally. While waiting for the other health workers to come and start our health program, a family came with a child in their hand, not knowing what has happened, to be examined by the healthcare workers so that they can rescue the child. After examining the child, the doctor gently declared, the child has passed away, probably sometime in the night. It is no longer alive. With sadness, despair as the family left, what shocked me was what the doctor told me afterwards. He would see several such children being brought dead during the winter month. And this shaped my understanding about illness. And when I looked at that child or many such children, one thought kept happening in my mind. Can we prevent these deaths in young children? And that shaped whatever I would do for the next decade or so. While as I was trying to figure out what is the extent of this problem, what I realized was the hidden threat of vulnerability affects deep within our society. Not just medicines, not just these four walls of the hospitals, but it is the hidden thread that affects all the cradles, especially in the poor countries. I wanted to understand how extensive is this problem. 5 seconds. 5 seconds is all it takes for one child to die in some part of the world. And as a result of this, you would see in 1990, there were more than 170 million children being dead in the 1 year alone. And that resulted from 178 million, which we call as premature mortality, which means that how long the child can survive if it was expecting a normal life. That was 178 millions of years of lives lost. That reduced in 2023 by 66% to 59.8 million. And two-thirds of this reduction was possible only because of the vaccines. Vaccines are the hidden power which can take away this hidden thread of vulnerability. Against diseases such as diphtheria, pertussis, tetanus, and measles, these vaccines protected these children. Every mother fears that whether the child will be healthy or not, because these diseases make the children invisible, unseen. And I know what it means to be unseen. Can you identify me here? Probably not. As a eldest son in the family of poor parent teachers, I knew what invisibility mean. Was lost in the conversations among the social structures without knowing how to fight my vulnerabilities. Everybody thought these vulnerabilities will break me, only it didn't. And the reason it did not is because I chose to convert these vulnerabilities when after I completed my medicine, I chose to work for a program called polio eradication. Polio is a crippling disease. It results in paralysis of the limbs in children. Sometimes even it results in death. So when I chose to work for this program, India was at the crossroads. And at that time, every dose of polio vaccine was only the hope that every mother would get, because this is the only way the hidden thread of vulnerabilities could be tackled. And as I signed up for the program, India had highest cases of poliomyelitis in the world, with more than 265 children being crippled each year. And every nation almost said that India would be the last country to stop the polio transmission going on. What we did was we started trusting the data. When the entire world was drowned in opinions, what we did was turning the spreadsheets into strategies, maps into missions. Every data point that we collected was turned into decisions. And by doing that, we went after searching for the virus in every nook and corner of the villages, crowded slums, and in silent corners before the virus can attack the children. This is what we call as active surveillance. By doing this, we started showing the reduction in cases, and that's when the world started leaning to listen to this success story. As we did with the polio program, what we understood was beyond numbers, there's so much for us to learn. Because behind every number, there was a crippled child that we were tackling. And the fears of the communities and the beliefs that they had about the program, this is what had to be tackled. And this is what I call as empathetic actions. So numbers are not enough. The data is not enough. What we learned was empathy on the go. And as I moved beyond the numbers, when I went to UCLA to pursue my master's and PhD in epidemiology, from the dusty lanes of the villages, now I was in the corridors of data dashboards, I heard the last case of polio recorded in India in 2011. After decades of struggle, one last case. Although this was the end of polio in India, this was the beginning of me to understand what I call as human equation. What human equation means is vulnerability is seeing the numbers, making sure that these are not numbers alone, these are the people behind it. Evidence is in terms of trusting the data, not the opinions of the world. And most importantly, empathy is the power that connects these two. And when you connect all these three forces together, you just don't create programs or policies, you create impact. And this is what I call as human equation. And the first application of human equation was in a disease called as measles. And you would have seen most children with fever and rashes, probably not very serious. That's what most people might think. Not so much. This can result in several complications, be it the infections of the brain, lungs, sometimes even death. And it's highly contagious disease. So when I submitted the proposal to start applying this human equation for measles, then the government did not have plan for measles. That was the first time a multi-year plan for measles elimination was started in India in the year 2006. And what was the impact? The impact was phenomenal. We repeated the same ordeal, collecting the data, identifying the clusters, and making sure all the uncovered children are covered with additional doses of measles. As a result, in the first 5 years, we saved more than 80,000 children. Until now, more than 1.2 million children have been saved. This is the impact of human equation. Although it's successful, I run away from all the fear of these vulnerabilities to seek refuge in my family. You would see my beautiful wife and two wonderful daughters that I have, and you might wonder, I'm the lone man standing here. No, I'm the lone man learning. Be it the working mother, be it my sister, be it countless working women, some of them who are my colleagues, what I have learned from them in their own way is vulnerability often takes the face of a woman. We understand how to balance strength and struggle by looking at the women who work around us. And this is where I learned something very simple but very profound. The generations of women transmit vulnerability as their intergenerational inheritance. Even before a child takes first breath, there is this vulnerability being passed on, both biology and in terms of psychosocial environment. And this was the reason why I again started applying the human equation in something called as MASTI. MASTI is a cohort. Cohort means a group of individuals being followed. Just in this case, I followed the pregnant women and their children. What it covered was the intergenerational hidden threads of weaknesses, both in terms of biology and also other psychosocial influences from mothers to children. We just did not collect the samples. We ensured that this data collected transforms into actions. And those actions were led by empathy. As a result of that, MASTI has been able to set up programs which are looking at identifying high glucose levels in mothers, mental health problems in mothers, and how it would reflect in the children's well-being in the future. This has been a phenomenal success, and it has been working for more than 10 years now. This has been the single most achievement so far in terms of applying the human equation in my career. All of this while being done, where we could cherish all these successes, the pandemic hit us. And when COVID-19 struck us, it was not just a test of science, it was a test of our societies. the trust that we had. And it also exposed the vulnerability in the community. Elderly people, people with comorbidities, all of them were at the higher risk of dying. And this is again when the human equation came into practice. I was part of several committees, including international, regional, and local, where these meetings were more like war rooms. Because every decision that we take would result in the destiny of few people being protected. And this was at a time when misinformation was being spread more faster than the virus, and it was more dreadful than the virus itself. That's why I took to write to common people through several articles, editorial commentaries, and making sure that I'm on the media, I'm in the public reach all the time. Not to be in the limelight, but only because science-based communication was the only vaccine we had at that time to counter misinformation. After COVID-19, the success was great. We could prove that by applying the human equation, we could even apply it to crisis, not just the routine health programs. And that's when I matured into the next step in my life in terms of applying the human equation. Where I work now at Qatar University, it gives me an opportunity to work with several countries. And when we see a country such as this, I don't want to name the country, but you see the figures here. More than 690 women die before they're giving birth to a child. 1 in 5 women get attended at a hospital for delivery. More than half the children are not vaccinated. Thanks to my position at Qatar University, I work with these countries to create contextual, specific, evidence-based, locally rooted solutions. And this is the power of applying human equation even as of now, and thanks to the wonderful opportunity that's created by the coalitions that are at Qatar University. Not just this, even though I left polio, polio never left me. In the next phase, here at Qatar University, we are running a course for developing countries where we are creating the next generation of health leaders so that they just don't go and stop the outbreak, but they also transform the health systems. They also become the role models for their own countries in implementing evidence-based public health. This has been not possible just by myself. And this is happening, all this because there are people who believed that I could. There are many people to thank for, be it the first teacher, Lily Rose, who pushed me into the first debate as a primary school student, Professor Srinath Reddy, who built the Foundation for Public Health, which trained several people like us, and Roger Dittels. He was not just advisor to my PhD degree, not just the doctorate, also shaped my destiny by giving discipline and direction. They believed that their legacy is not in what they leave behind, but what they instill in others. And this legacy continues as I move to Masti. And you would see a group of brilliant, bold, compassionate young women, some of them who started as my PhD students, now are the leaders of running this cohort. What started as field notes now is a hub for innovation. They are converting the vulnerabilities that they saw, that they experienced, into evidence-based actions that has become a hub of not just innovation, but also evidence-based public health implementation. And this is what they prove. The true power of education is not just taking all the credit and gaining all the knowledge, it's sharing the light. And so, therefore, I make sure that they are also doing the same as they move forward to make sure that everybody gains as the process of enlightening their paths ahead. The success in health field has been so far. We have employed human equation to every field that we could explore. But is it only about health? Is the human equation applicable in other sectors also? I'll just give you an example. This is something called dependency ratio. And if you see, for Qatar, the dependency ratio is to be really high, about 80, many decades ago. Now, fast forward, the dependency ratio has come to 20. At the same time, you would see US, Japan, and even China, all the other countries, the dependency ratio is going up. This is just another piece of data around us. What it says, is far more powerful enough. In Qatar, the productivity has gone up. Therefore, the number of people who are dependent on the productive workforce has gone down over years. Whereas if you see the other developed countries, the number of people who are dependent on the working or the so-called productive workforce have gone up. What does it say? It simply suggests one thing, that while shrinking workforce is affecting those countries, there are more and more elderly who don't have a voice. There are more and more children who need services. And those countries are not prepared enough to address this as of now. And this is what I call the power of human equation. There is data around all of us. It all depends on how we look at it. So the idea that sparked this reflection in front of this august audience is that science generates evidence. Vulnerability provides direction. Empathy gives you the power to act. I have lived this truth. So my plea to all of you, ladies and gentlemen, is can you identify your fear, your vulnerability, your doubts, and transform them into something far more powerful, not just to uplift yours, but also those who are around you? Can you convert your vulnerability into empathetic actions? Thank you.